I'll let you start off.
So, good morning, everybody. I always get confused because it's 12:30 here. But thank you so much for joining us today. My name is Emily Bands. I'm here with my colleague Dawn Reinhard Wood, and today Dawn is going to be presenting our webinar today on supported employment interventions and supportive housing. So, really looking at how to make that connection between those career-oriented goals the individuals that you're working with want to work on. How do we then connect that within the realm of supportive housing services?
Oops, sorry.
So as you all know, today's webinar is hosted by DBHR through Washington's Healthcare Authority. We are going to be hosting and facilitating an interactive training today. We're going to encourage you to ask questions throughout the session. We're going to be asking questions, so please be on the lookout in the chat box. If you do want to respond by speaking, let us know and we can give you permission to unmute yourself. But if not, commenting and discussing in the chat also works as well. And then the slides and a link to the recording of the webinar is going to be available and sent out after the webinar today.
Thank you, Emily. And I failed to put a bio slide in here for myself, but I haven't looked to see who has joined us today, but you've probably seen both Emily and I here before. So I will just keep it brief. Emily and I both are employed at Rutgers in the Department of Psychiatric Rehabilitation and Counseling professions as lecturers here. And most of my work experience has been in supportive housing and adult clinical case management services, disaster, and homeless outreach. And Emily has a similar background in supportive housing and works on a technical assistance project, also focused on what we call here in New Jersey community support services, which are your foundational community supports. Trying to keep all the acronyms in line, distinct, memorized is a difficult thing. I'm also going to apologize a little bit to you because I do have some kind of, I don't know if it's a cold or allergies, but I may be starting to lose my voice during the presentation. I will try and be as resilient as possible. And I have a big glass of iced tea here. So I may be pausing at times, but I know you'll hang in there with me. So I'm really excited to have you all here today. As Emily stated, you know, I don't know what all of your roles are in supportive housing, but I do know that supported employment is something that we often think as very separate and distinct, a distinct service from supportive housing. In fact, it is a distinct service from supportive housing with its own separate toolkit and guidelines for adhering to the practice fidelity guidelines. But that doesn't mean that you can't use elements of supported employment in your supportive housing practice in interacting with the individuals that you serve and working on, you know, some of their overall rehabilitation goals. So some of the things that we're going to do today is we're going to talk a little bit about supported employment, the benefits of work, so really defining supported employment, and especially around those things that we can take away from the work experience that also help us clinically and help our psychology and our overall well-being for ourselves and also for the individuals that we serve, right? So I often like to think about a lot of the services that we provide, the interventions that we suggest, our talks about wellness and dimensional wellness, first about how it applies to us, right? Because I think that that helps us understand how we're relating and talking to and trying to help motivate the individuals that we're working with to help recover. We will talk about a few supported employment interventions. Now, please know that there are a lot of supported employment interventions out there. I really highlighted a few that I think that you can make fairly easy use of, quick use of in the supportive housing environment. And a couple of them also can help you in other areas when working with individuals, not just around any kind of vocational or education, employment related goals. And we will talk about applying those supported employment interventions for appropriate use in supportive housing settings. So we'll kind of be talking along the way. That point will kind of roll into the second point as we talk about, or the second objective, as we talk about these 3 or so supported employment interventions. I hope that you will also see as we talk how you can use this, in your day-to-day visits with individuals, and hopefully give you some more, I call it intentional fuel, or fuel for intentional service provision with the individuals that you work with. When I worked in supportive housing for 16-ish years, sometimes it really became a struggle to continue to engage individuals, especially when they felt like, or they couldn't seem to identify goals that they wanted to work on. And sometimes I don't even like to use the word goals. You may see goals written throughout here, but you can use whatever term is comfortable for you or for the individuals that you're working with, because sometimes goals can be really scary, especially if we've perceived ourselves as not attaining previous goals or failing at goals in the past. So we'll talk about that moving forward, especially when we get to goal exploration, and how we can really break those bigger goals down into smaller action steps. So I wanted to start with a poll question. When did you determine your career path? So if you can only select one answer. Maybe you're a little ambivalent, and I wish I could answer this as well as the poll administrator. After you all answer, I'll let you know mine. We have a small group today, so I'm gonna wait till we get to about 80-90% done. Let's see what we get. Maybe 10 more seconds, 20 more seconds. We'll say 10 more seconds. That'll officially be a 1-minute poll. Okay. So can you all see my results or see your results? So the question was, when did you determine your career path? It's interesting results because they're kind of, I don't want to say they're equal, but they're not all that far apart, right? So we see that just within this group of 21 folks, 22, 23, if you count Emily and I, about a third of you, about a third of you are confident in the decision that you made years ago. About a third of you are working in a career, but you may want to explore other paths. A good fifth of you are still trying to figure it out. And almost a fifth of you are like, I'm going to figure that out when I grow up. So I have to tell you, I'm probably in the I'm still trying to figure it out part. Not that at 47, not that I don't absolutely love my job and I'm thankful for my career and have had a really great trajectory in terms of getting clinical experience and then building on that with education and now being able to teach and still dabble my foot into the clinical world. I'm just not sure, right? So I'm still open to the idea that this may not be what I'm doing. This may not be the career that I retire from whenever I'm able to retire, no time soon. But I'm still exploring. I'm still looking. There are still aspects of my career, of my current profession at this current employer that aren't quite, or I should say there are parts of my self that still feel slightly unfulfilled, and parts of myself that felt more fulfilled in a direct care / supervisory job. So it's my ideal job would somehow blend those two to where I could still have direct service experience with people, lead a team, help people grow through training and mentoring. And also I like this educational aspect of it too. I like being involved in research. I like consulting with people. I like sharing my experience, and that doesn't mean I have all the answers, because part of that is I like learning from other people too. So I'm curious about people out in the chat, or in the webinar today. If you wanted to speak as to why you answered how you answered, and what are some of those questions that you're still having for yourself. And if you feel like you're in solid footing in your profession and you feel like you really belong and it's a great match for your values and for your mission in life, why? If you'd like to speak on the mic, that's fine. If not, you can share with your colleagues in the chat. I see Kelminda said, I graduated and realized I was unwilling to do a job that exploited the poor. Unfortunately, that is most jobs. Eventually, I typed the word homeless into ZipRecruiter and was hired on my first application. I love that. And are you satisfied, Kelminda? Like, I'm guessing that because you made that direct search, that you are now in a job that, at least in terms of where your values are, is aligning better than perhaps business or retail or another profession. Jamie says, theirs keeps getting an error code. Is that the poll or is that your career? Nicole, yeah, absolutely. And I think that, I talk about certain degree paths, and for a number of years, I felt as if I made a mistake in the degrees that I attained, because I felt like, wow, I saw my social worker friends who were bachelors of social work and then became clinical social workers really be able to work in so many different fields, in for-profit, in nonprofit. Their road was just wide open. I'm sorry, Jamie. I'm sorry it didn't work for you, but thank you for trying. And I have to say, like, that is a struggle to look back to owe student loans and then to have regretted your major choice. And I'm so happy that you picked one that is extremely marketable and fulfilling for you. So Shelley says they've worked in service for over 20 years as a caseworker for a shelter, caregiver, and knows that she enjoys helping others. I love, all right, so we got a secret message, so I won't reveal the name unless she's okay with me, but doing that. But she said, I'm working on PhD applications while working. Really, I'm catching up on my career after taking time off for my children. And I will say that at times in my career, when I felt like I wasn't being fulfilled, maybe the work wasn't challenging enough, and this did happen in my prior work experience in community mental health, because the job became so routine to me. I absolutely loved it, but I always had extra time. And I know a lot of people in community mental health don't understand that, having extra time. But at the level that I was at as a director, I got my job down pat. I could do financial reports. I could, sign off on supervisions. I could read progress notes. I can read service plans and do all this stuff. I just had it down so well, but I still felt unfulfilled. And that's what started me on my PhD expedition, which is coming to a close now, thankfully. Michelle stated, spoke to being in customer service and feeling it So being in customer service for 30 years and finding, certain aspects of it as unfulfilling, or maybe like too much, mentally as strenuous. And I think that that's the thing, like, when we're also thinking about, as our individuals that we're working with start to enter the work field, for some of them, it's going to be their very first job. And I want you to think about like some of what your very first jobs were like. They probably were very low paying. They were probably highly labor intensive, maybe not, and also very mentally draining, especially if you've worked in retail, customer service, food service, banking, anything like that, where you have to interact with the public and they may not always be so happy. Now, it's interesting that you would think that you wouldn't, sometimes we run into some very unhappy people in the field that we're in, right? In mental health services or behavioral health services, but the mission is different. And I found I've always had more patience working with the clients that I've served in this field than in retail, right? Because we know why. We have the understandings of the why behind people being upset and so on. So I want to thank you all for contributing. I could go on and on and on and read all of these, but I just wanted you to kind of think about like why you chose where you're at right now. And if you're not where you want to be, some of like what those guiding lights or principles have been for you in seeking that career. I don't know, Emily, what about you? Sorry to pick on you, but like, I don't want to necessarily ask if you're happy with your job right now, but like, what are the things that you get out of your job, your career that you love? And maybe what are some of the things that you're still seeking?
And so before I answer, I do want to say, I think it's so important to just assess this regularly, right? Because I think I feel like I hear so many stories of people getting to a point where they're in their 50s or they're in their 60s and they're like, what have I been doing the past 30 years? So there was a bunch of people who said that they were in careers for a very long time and then switched over. And I applaud you for that, because I think
That's
it's so
hard.
good. Yeah, I think it's so good to be able to make that assessment and take that risk and really go to do something that now it seems like some of you are feeling more fulfilled. But I think for me, I think I've always been interested in helping others. I think for me, it's about finding a way that makes the most sense for me to be able to help others.
Yeah.
So I think when I was working in the community in supportive housing, that was very fulfilling. But somebody mentioned that switching over to working with this population is mentally strenuous, right? And that's what I was feeling. So when I switched over to working at Rutgers, I think I was able to help staff and train staff, but then I missed working one-on-one with individuals. So now I'm back to doing private practice work.
Right.
Right. So I think I'm on like a wave of just really figuring out what makes sense, what makes the most sense for me at what time. But that's also something that I'm very privileged to be able to do.
Yeah,
because I know that not everybody has the ability to be able to just go from, dabble in different things, which is what I feel like I do.
And I have a similar experience in terms of I'm not licensed as a clinician, but from time to time, the organization that I used to work with will say, hey, can we consult with you on something? And we'll work out this little agreement with Rutgers so that Rutgers, because I always say, I left you. You could have had me forever, but so now you're going to pay my current employer to allow some time to help you. But I love being able to consult on situations, being able to meet with individuals directly. I realize now though that I have so much more patience and I'm able to be present with individuals that we serve much more so than I ever was when I was doing the job as director day to day. And so like, I think also knowing that there's still that piece that you get nourishment from and finding ways to do that, whether it's through volunteering or whether it's through consulting or, paid employment is a wonderful thing to continue to be able to tap into that. Thank you. So now that we're all wondering what we're going to do with the rest of our lives, I'm hoping that, and it's funny that the two of the tools that I'm going to show you all today are actually a couple of tools that I used in a graduate course or that I had to become familiar with as a student in a graduate course on vocational counseling. which is something that I never had any interest in before graduate school. It, but it was really fascinating to me how much it tapped into our values and our own personal ethics and morals and ideas about what we want the world to look like. And so there was this beautiful overlap with, and I know it's part of psychology, but with what I always considered, general psychology. And I just find it fascinating. So we're going to actually look at a couple of those tools today, and they are tools that you could use for yourself. And I really, if you haven't used them yet, I strongly encourage you to, because it doesn't necessarily mean that they might help you identify an alternate career path that you're in now and you need to change career paths. They help elicit your strengths, your values, and perhaps help you figure out how you can put those strengths and values into action in the careers that you're currently in. So let's talk a little bit about what employment looks like among individuals who are diagnosed with serious mental illness. And I don't use the term serious mental illness that often anymore, because to me it doesn't mean a whole heck of a lot, because it's typically only referring to 3 diagnoses. When we think about serious mental illness, it's usually talking about bipolar disorder and the variations of that there can be, schizophrenia or schizophrenia kind of spectrum of disorders, and major depressive disorders. But when you see the word serious mental illness used here, it's because that's how it was used in the literature. So employment rates among people with serious mental illness. So as we see here, depending upon the level of symptoms that an individual is experiencing, employment rates drop as compared to the general population, undiagnosed or not identifying as having a behavioral health condition. So you see here the individuals who are symptom free, as they rate it, they have about a 75-76% employment rate. This isn't delineating between full-time and part-time, but that they're in paid employment, paid competitive employment. So when we use the term competitive employment, which you may see a couple times throughout this presentation, what we're talking about is employment that is open to the general public. So you may know about work programs, like work readiness programs, other like job coaching, sheltered workshops, these types of things where individuals may be in special settings when they are working. And it's usually individuals with disabilities, may not just be psychiatric disabilities, maybe a range of psychiatric and general physical disabilities. That is not competitive employment, because those positions are being held open only for those individuals, and probably certain accommodations are being made that wouldn't necessarily be made in other workplaces, right? Competitive employment is employment that is open. It's you see a sign at Home Depot, or these days it would be like, an ad on a website, or I haven't applied for a job in a really long time, but like some of you were mentioning Indeed and other kinds of, search sites. So, that would be anything that you would see posted there that would be open for the general public to apply for. Individuals with mild symptoms are employed at about 69%. And as you see here, we have about a steady decline as we go from mild to moderate to serious symptoms. So individuals who are expressing serious symptoms are about 50% employed. And the only thing that this study didn't, I think this was National Institute of Health study, the only thing that it didn't tell us really was like, are people collecting other forms of income during those times, disability. We also know that people with mental health conditions may call out sick. They may use unpaid sick time, and may not disclose, because of stigma and discrimination, what they are currently dealing with in terms of a health condition, right? So people may also not apply for benefits that they might be entitled to when they are unable to work because of mental health symptoms. The other thing that we know is then there is this pretty minuscule gap in terms of employment rates at the young age group of 18 to 25. The gap is only about 1% between the 18 to 25-year-olds in the general population who do not have an identified one of those serious mental illnesses that I just talked about, bipolar disorder, schizophrenia, or major depressive disorder. It's a 1% difference. I mean, not a huge difference. When we get to the age group of 50 to 64, the gap is 21%. So you see a much more significant gap as individuals get older. Anybody want to take a venture and guess why there may not be much of a gap, if one at all, in that 18 to 25-year-old age range between the general population and individuals with serious mental illness? Sure, Kelminda, let me see. Let me give you the mic. Go ahead, you can talk.
Yeah, so I was thinking that a lot of times when you're young like that, even if you are seriously mentally ill, you don't qualify for a lot of programs that would give you income. Because a lot of programs at like SSI, SSDI, they want you to have some years of work history. And if you don't have that, especially if you're young and your diagnosis isn't typically like a for sure winning case with SSI, you're more likely to get denied. Younger disabled people probably just don't have as much of a choice as older disabled people do.
That's definitely probably one of the reasons. Absolutely. So they don't have the work history. They may not even know that there's any other option, right? Other than working. They may not have the documented history of the impairments on their functioning, right? That a 40-year-old, that a 30-year-old may have, even to be able to document these. I hate to call them failed attempts at working because I just don't like that phrase, but I'm going to use that phrase. Those failed attempts at work that just didn't pan out because there was this underlying condition that nobody's figured out yet, right? So once an individual gets into their 30s or their 40s, they may have that documented history of work attempts that just didn't pan out.
Yep.
Right, and hospitalizations and whatever may be. Does anybody, thank you, Kelminda, I really appreciate that. Anybody else either in the chat or want to grab the microphone and offer another reason why? Maybe? I have one if nobody comes up with mine.
Also, how do I know if I'm muted again?
Oh, I can do that for you.
Oh, thank you. Thank you.
I know you don't want to be caught
on a live mic. Yeah.
All right. There you go. You're muted now. So one of the other reasons that immediately comes to mind for me whenever we're having a conversation about differences around this age range. I see somebody popped into the chat. Let me see. I like that, Jay. Wait a minute. Maybe that wasn't Jay. Nicole said that maybe young people don't recognize their mental health symptoms, so they don't feel limited, right? And I can actually really see that panning out with certain symptoms of certain mental health conditions can actually make you, at least for a short period of time, at least feel very productive. When you think about some of the symptoms like hypomania or manic symptoms where people have like this feeling of boundless energy and creativity, right? That may feel like drive and motivation until you kind of come down from it and maybe realize some of the negative consequences of being so, full of energy for a period of time. Jay said maybe the nature of their jobs, right? So maybe the jobs aren't as, maybe they're not as demanding. Maybe they're not as stressful. I was a very anxious kid. I'm a very anxious adult. And so I was always anxious on the job, but like maybe for others, like maybe their jobs are, I don't want to say easy, but they're easy enough. They're manageable enough that it doesn't tip the scales, that also that they don't have to compensate as much, right, for maybe some of the deficits that they're experiencing that are consequences of a mental illness, because these are jobs that, they're almost overqualified to do. So thank you. Thank you to both of you. So one of the things that I always think about when we're talking about, like, whether it be gaps in skills or experience, lack of experience, is the age of onset for a lot of mental health conditions. So for a lot of mental health conditions, especially schizophrenia and bipolar disorder, major depressive disorder, we know can happen at any point across the lifespan: childhood, teen years, adulthood, older adult years. And that's not to say that schizophrenia or bipolar disorder can't pop up early-ish, can't pop up a little later than what we're typically is normative as far as what we've learned in school. But that's kind of like outside the norm. So what we tend to see is a lot of individuals, their first psychiatric symptoms tend to arise around late teen years through mid 20s. Men, I believe, a little later than women. Sometimes women can sometimes individuals who give birth can experience a triggering effect because of the stress on the body and the changes in the hormones, and they may experience a major psychiatric onset of an illness a little bit later than usual. But we tend to see it in this kind of late teen to late 20s range. So the fact of the matter is, there may not be a lot of people, as some of you have been saying, that, number one, even know that they have a mental health condition. Number two, if maybe they do, they're not recognizing any impairments at this point. And so by age 50 to 64, a lot more people will have been diagnosed, and not even as important as or I should say more important than diagnosed, have actually experienced the consequences of having a psychiatric condition, right? The other thing that we also know about individuals who have what we consider the serious psychiatric conditions that tend to be the most potentially disabling, as per the Social Security Administration and the World Health Organization, is that those individuals tend to die on average. I don't know, Emily, if you have the new figure, but at one point it was like 10 years earlier than the general population. It got up to 15. Then people were bantering around 25 years as the longevity disparity. And I don't know exactly where that is at this point, but I will say that in our state-run psychiatric hospitals here in New Jersey, which is like my home project, is acting as a consultant to the state psychiatric hospitals, we consider 50 to 64 to be geriatric. And maybe even earlier. We have some people in their late 40s in the older adult units because of the medical impairments, because of the physical impairments that are a consequence to the mental illness. And those may be simply from institutionalization, right? Not having the ability to exercise, to socialize, the consequences of certain psychotropic medications that cause metabolic syndrome, diabetes, hypertension, other health conditions that can shorten our life and hasten our death. So there are a number of reasons of why this can happen. But I believe that one of the reasons that the older adult age group, and I hate thinking of 50 as older adult because, like I said, I am almost there. But thinking about that is because they also have a lot of physical complications that tend to be consequences from having a serious mental health condition and also participating in treatment for serious mental health conditions. I'm sorry, Siri is talking to me, and I don't know why. Just have to turn her off. So thank you, Kelminda. I appreciate that. Totally appreciate that. And I'm going to copy it and save it. Thank you. So some barriers to employment that I want to talk about here a little bit. So reasons why individuals with serious mental health conditions don't attain employment. What the research tells us is that those tend to fall within 5 categories. Primarily limited number of jobs in the community. You see right now, everybody's hiring, right? Or at least for a while they seem to have been. I don't know if that's slowed down any, but there are a lot of jobs. But as it relates to our 5th bullet here, can people get to them? Can they access them, right? So there may be there may now be more jobs than there were when this study was done. It was 5 years ago. There may be more jobs available in the community, but can people access them? Do they have the technology to even know that those jobs are being posted? Do they know how to use a job search website? Can they get to the job? Certain areas of the country, I would assume that Washington is probably similar to New Jersey in at least one aspect, and that is probably the disparity in where public transportation is available and accessible. I know that you guys have some very rural and remote areas or frontier areas. In New Jersey, the difference between the north and the south of our state is like night and day when it comes to access to public transportation. I've lived in the southern part of the state all my life, with the exception for when I was in undergrad. And I was floored that when I was in undergrad, like nobody that I knew drove. And if I didn't have a car, I wouldn't be able to get anywhere because we had such limited transportation. Discrimination against people with mental health conditions. So I want you to also think about, not only do the people that we serve perhaps face discrimination and stigmatizing messages solely around having a mental health condition, but also any other identities in terms of their personal characteristics that may also draw stigma from society. So there may be intersectionality that individuals are also facing, intersectional kind of stigma around multiple characteristics. Cognitive impairments, so individuals with some of the more serious behavioral health conditions may also experience disturbances to their ability to think critically, to concentrate, to be able to even tolerate filling out a job application. Just personal story for me, I'm someone who has been diagnosed with major depressive disorder and an anxiety disorder. And there have been times in my life where I had to schedule time just to sit. You're going to sit at your computer and you're going to write a sentence, or not even telling myself exactly what I'm going to write, giving myself a time limit. You're going to sit there, you're going to open up your dissertation, and you're going to work on it for 15 minutes. What usually happened was I stayed around longer than 15 minutes, but it was just knowing in my mind that I could tap out after 15 minutes, whether I did anything or not, almost like a desensitization approach, totally a desensitization approach. Works for me, may not work for everybody, but just know that individuals may have cognitive impairments, and there are things that can be done to help kind of remediate that. It is called cognitive remediation, but we're not going to get into that today. Lack of supported employment programs. So there aren't a lot of supported employment programs. I know in New Jersey, they are very underutilized. We have them. People tend to not know about them. People know about our state-run vocational rehabilitation program, but they don't also know that there are mental health organizations that also offer supported employment as a program of interventions to help people kind of recover and develop job skills. And again, I touched on inadequate transportation. And if anybody else has thoughts around things that they see in the individuals that they serve that seem to act as a barrier, feel free to put it in the chat. So although there are barriers to individuals being able to attain employment, there are also some significant benefits for people who work. And none of these, and of course some of these, but I'm talking aside from direct financial benefits. Earlier we were talking about individuals having a financial benefit. Perhaps they don't have enough work history to file for things like SSD. SSI is something that you could file for when you don't have significant enough work history to qualify for SSD. But still, you need to have a documented history of, some sort of functional impairment attributed to a major disease or illness or injury. And finances are important. But in this case, we're talking about those things that are adjacent kind of to the finances. So self-esteem, right? When you accomplish something, when you do something, especially when you're doing something that you enjoy and love and feel like you're helping others or getting close to whatever that personal value set is, it's a boost in self-esteem. And the thing with self-esteem is, as your self-esteem raises in one area, it's like this behavioral activator, and you start to feel like, if I could do that, I might be able to do this other thing that seems really hard. And I sometimes talk about weight loss as a great example. I mean, for me, that's one of the examples that I used. I fluctuate with my weight, but a number of years ago, I started a weight loss journey and I lost 90 pounds. I gained 20 back, but I'm still down 70, right? When I did that, it was the hardest thing I've ever done in my life. And I have a 15-year-old son, and that's pretty darn hard. For anybody who has teenagers or knows anyone who is friends to anyone who has teenagers, having a teenager is hard. That was the single most difficult thing that I ever did, because food was always the coping skill. It was always the coping skill for me, the go-to. And so when I realized I could do that, that's around the time when I said, I can probably do the PhD thing. I've always been an okay student. Once I got to college, not so hot in high school. Once I got to college, once I found my area of interest, I actually like learning, and education didn't become another burden until I got to my dissertation. Now it's a burden, but it will get done. So like those small wins, no matter how small they may be, they may appear to you, even at the time that you're doing them for yourself, or even at the time where you're trying to coach and help the individual that you're working with in supportive housing or whatever program you may be working in. Those small wins are so important, and please don't undervalue them. And so when we look at goal exploration, we're going to look at like those short-term kind of objectives and how important they can be. Social supports. So think about your place of employment. I know for me, we don't, as someone who used to manage people, sometimes I had to intervene in coworker disputes. And I don't know about you, but I've had to use that line. You don't have to like your coworker. You don't have to be friends with your coworker. This doesn't have to be socialization. But doesn't it go a lot easier? Isn't working a lot more fun when you do like the people that you work around? So sometimes we're fortunate enough to develop these social networks through people that we work with. A lot of people meet significant others in their place of employment, right? So thinking about individuals who are receiving services in supportive housing or in other kind of program areas in the mental health system, sometimes individual social networks can be really, really small and constricted. And if you're working with individuals who may have come from an institutional setting, like a hospital or a corrections setting, even the homeless environment, different program elements within, homeless services, individuals are very much surrounded by people going through the same exact circumstances as them. Maybe not exactly, right? But they're all kind of in the same place. They're all kind of dealing with the same system. They may be dealing with similar kind of symptoms and things like that. It's not to say that you can't find support in that, but you have a constricted social circle, and we don't want to replicate a psychiatric hospital in the community. So offering somebody an outlet, whether it be through work or through education, volunteering, or other kind of social outlets, is something that we want to encourage. And so, working is another way to kind of tap into new social networks with people who may not be exactly going through the same experience as you, but you may share other common interests, right? If you really like animals and you decide, maybe as the first step, I'm going to volunteer at a shelter. A lot of the volunteers in shelters are people who love animals. I've done it. I do it with my son, and I connect with a lot of other really, animal obsessed people by doing that. And I love that. And so thinking about social supports is also a benefit of work. Knowledge, obviously not just the knowledge that the individual requires to do their job successfully, but also kind of like some of those other soft skills that people learn in interacting, the interpersonal skills, the way employment works. You may even learn a little bit about employment law around the way, but just kind of how to navigate that professional world of employment. And the, depending on what field of employment it is, or what sector of employment it is, maybe some of those nuances in that field. And also exposure to other jobs that may be similar that individuals have not even thought of yet. Sorry, I need to take a sip because I'm getting croaky. Turning into a frog. And skills. So again, not just the technical skills that the individual needs to do their job, but employment related skills. How to write a resume. I don't even know if people do that much anymore. If it's all inserted into, it's probably kind of just inserted into some kind of a template online. But really, how to, and I don't want to say sell yourself in any kind of cheap way, but I mean like how to sell your skills and how to, recognize those strengths that you have. And I think that is also a really valuable activity to engage in, creating a resume, creating a CV, and really, drawing out from the individual what their strengths are as they see it and as you see it. So let's talk a little bit about what supported employment looks like. And we're not going to spend a ton of time on this. I'd rather show you some of the tools that we're highlighting so that you can get to know them and hopefully utilize them with yourself as a practice run and maybe with the individuals that you work with. So supported employment programs, when we're talking about kind of like a standalone supported employment program that you may refer an individual to, link an individual to, be working alongside maybe a supported employment professional in care provision or service provision to those that you work with. They help people with psychiatric conditions participate in, again, what we call competitive labor or the competitive labor market. So again, those are those jobs that are open to anyone, you, me, any other person out there who is not identifying as having a mental health condition and needing or requiring some sort of sheltered or almost like protective work environment. That's not to say that an individual who works in a competitive environment can't attain or obtain accommodations for their condition, right? So those are things that an individual, if they qualify for conditions under the Americans with Disabilities Act, would need to communicate to an employer upon hire. And accommodations can, reasonable accommodations can be made. Let me give you an example of, a reasonable accommodation. So for someone who may be low vision, they may need a magnifier on their screen, or they may require a screen reader. Individuals with mental health conditions, perhaps I know I've worked with individuals who had fairly regular established appointments with their therapist or with a nurse practitioner, their prescriber. Maybe they were attending an intensive outpatient program or something like that. Or maybe they have insomnia, maybe they have difficulties with their sleep patterns and they need to work a shift that's maybe in the afternoon or, a different time of the day. And so being open and communicative with an employer around that could be, a reasonable request for an accommodation. And supported employment providers kind of help people like navigate how to have those conversations with potential employers. Whereas that may not even be a conversation that needs to be had in a sheltered workshop or in a kind of like job protected kind of job program where individuals are assembling things or working in like a simulation kind of office or anything like that. They help people find meaningful jobs. So they use some of the tools that we're going to talk about today and probably a whole lot more. Because I'm not a supported employment professional, I'm highlighting those that I have used with individuals in supportive housing, those I've used with myself, those I've used with undergraduate students that I've mentored in helping people kind of connect with their values and their jobs or things that they would like to do. They provide ongoing support from a team of professionals. So typically supported employment programs also have job coaches. They may call them different things, but essentially those are individuals that check in with their clients, find out how the jobs are going, if there's any kind of barriers that they're encountering, if there's any kind of stigma or discrimination on the job that they may be encountering, or any kind of like skills deficits or struggles, and also kind of reviewing the accomplishments and successes that the individual has had and really celebrating those successes. They tend to occur in integrated settings. So very often individuals who are participating in supported employment, they may or may not have visits from their supported employment support professional at their job. And that's usually driven by the individual employee, the person receiving supported employment services. They may not want a job coach showing up at their work site, right? But that could happen. And the individual from supported employment is also able to meet with the employer, to work with them through various requests that the individual may have, accommodations, or ways in which the person's job task can be structured to set them up for success. And again, like remembering, like this all has to be reasonable, right? We don't expect an employer to completely change their operations for one individual. That's typically not what happens in supported employment. But what we're looking for is this partnership. And so very often supported employment programs do a lot of work in cultivating potential employers. So they lay a lot of groundwork very often with employers that they know are open and willing and happy to work with individuals that are in supported employment programs. And one of the things that I used to use as a talking point with potential employers, with individuals that I was helping to support to attain employment, was if they don't show up, like I'm going to follow up, like, right? Or their supported employment, their job coach is going to follow up and find out what's going on, right? So what other employees really have that? Like if I don't show up for my meeting at Rutgers at 10 a.m. on Monday, they're not going to call my mom and find out where I am, or my mom's not going to say, hey, your boss said that you didn't show up for work today. What the heck is going on? Get out of bed, get your coffee, get your act together, right? That's not going to happen. I'm just not going to show up. It's a similar argument to what I used with landlords and trying to cultivate landlords in supportive housing was, when individuals had a voucher, a rental voucher, and had supported supportive housing assistance, was you're not only going to get 3/4 of your rent paid by the government, right? You're also going to have a housing specialist following up and trying to make sure that that apartment is maintained and that the individual is learning how to budget and do all these things that no one does for any other tenant that's not in a supportive housing program, right? And I know things can still go left, But like, these are some points, these quote unquote selling points that they do use in supported employment to try to like really like cultivate that pool of potential employers. And I think probably the most important aspect of supported employment, which I think is shared with supportive housing, is helping people to discover their own paths to self-sufficiency and recovery recovery from mental health conditions, recovery from substance use, uh, um, re, dependence, recovery, social recovery, right? Regenerating kind of that social network, or building a social network that was never there or was insufficient. Helping people find their chosen family for a lot of individuals that we work with is a big thing, because so many people are disconnected or alienated from their families in a lot of ways. So in this way, supported employment kind of helps along that path to self-sufficiency, kind of those financial aspects of it, and self-determination and self-reliance that are so important to all of us, instead of resigning oneself to disability and dependence. So one of the things that I want to pause here to say is, like, there's camps in every profession, and I have heard people say no one should ever go on disability, no one should ever get at a file for SSD, you should try to work despite your clinical symptoms, right? I think that there's a happy medium. I think that if an individual is eligible for services, is eligible for benefits, I think that they should apply. The problem is that if one only relies on government forms of assistance like SSD or SSI, it really confines them to a very, as you know, restricted, pot of money every month. And it's really hard for individuals to live beyond, check to check every month, even with a rental voucher, even with other supports, food stamps and the like. It really is resigning oneself to poverty, right? And then we see that kind of happen and replicate generationally sometimes for individuals. And so one of the things, I don't know how many people are aware of with Social Security disability, and also with supplemental security income, which is SSI, which is what individuals receive when they don't have a significant enough work history to qualify for Social Security disability, which is SSD, is that it doesn't just stop as soon as you get a job, right? So one of the things that supported employment can help with, and one of the things that supportive housing case managers and coordinators can assist with, is navigating that world. And I would suggest to you that if you're not familiar with some of the basic rules on working while receiving SSI and or SSD, look into them. Individuals on SSD are able to earn up to a certain amount of money. Years and years and years ago, when I was in the field, it was like $17,000 before their SSD would start to reduce. It may be different now. Please don't assume that that number is correct, but there was a certain threshold that they would need to surpass before any of their SSD would start to be reduced. Very often, even if the financial benefit is reduced to zero, most individuals can still keep their Medicare, I believe. But again, that is something that, if you're working with an individual who is receiving a government entitlement, this is something that a provider can assist with determining. And SSI, I believe there's a monthly amount that the individual, if they surpass their SSI benefit, typically gets reduced $1 for every $2 earned, I believe is the rate. So just know that there is the possibility for individuals to work and still have a financial and medical safety net in this cash benefit and medical insurance. Does anybody have any questions about that? We could probably do a whole webinar on that, and I am not the expert in it. And as you see, like, I've kind of gave you mushy numbers, but I just kind of wanted to communicate that tends to be a big fear with people in the services that we provide, that if they work, and they may have heard this from professionals, if you work, you're going to lose your benefits. It is not necessarily true. If you work and you're receiving benefits and you don't follow the rules, you'll probably lose your benefits. But we play by the rules, right? Okay. And Kelminda, I just saw your last message and I'm loving you for it. You're absolutely right. It is very difficult. And we just, and also our body goes through so many different changes that, you know, we have to go through it, and it's a day-to-day choice. So I had an anonymous question about how many hours individuals can work, and I'm guessing that means like so as not to affect benefits. I am not 100% sure, so I'm going to just tell you that. A lot of what I have seen in the Social Security literature and other like kind of assistive guidance on working while receiving benefits is that it's actually a monetary figure and not an number of hours worked. So I know at one point in time for SSI, it was like anything over $150 in a month. I don't know if that's changed. And again, like I said, and this is dating myself probably 15 years, at one point in time, the figure for SSD was 17,000 in a year before it would start reducing. And again, that figure was more generous because you have paid into the SSD benefits, right? So it's kind of like your own insurance that you've paid into and you're now tapping into during your disability period. And people can come off of Social Security disability or SSI and return fully to work. I have seen people do it and do it successfully in supportive housing. So let's start to talk about some of those interventions. We have about 29 minutes left. So let's get to that. So I'm going to talk about 3 specific interventions. These are ones, the first one, you've probably all already used with individuals if you're working in direct service with people, whether it was in supportive housing or in a group home or in homeless outreach. You're probably familiar with exploring goals. There's nothing really too fancy about it, but you do kind of want to have a process or a structure to how you do it. So we're going to talk about that yeah, Emily.
Sorry, I put a link in the chat box. Ignore that link. That's not the right link. I'm going to find the information on the SSI income.
Oh, wonderful. Thank you so much. I appreciate it.
But just ignore what I put in there.
We will ignore it. The other thing that we're going to talk about is something called ONET online. It's actually something, it's pretty cool. It looks kind of cheap when you use it. It's a government website. It looks kind of cheap, but let me tell you, it's actually pretty cool. As opposed to this other one called VIA Institute on Character, which is a little bit flashier and fancier. I think it comes out of one of the universities, but it's also really interesting, fun, informative, personally. So I would honestly suggest all of you try these last 2 at some point. And in the references section of the PowerPoint, which you will receive as you always do, there will be links to all of these resources and references. So first I want to show you a brief, I think it's like 2.5 minute, 3-minute video on the 8 dimensions of wellness. These were initially created by one of well, she's now with our healthcare side of our university, or behavioral healthcare side of our university, but one of our professors, Dr. Peggy Swarbrick, in collaboration with SAMHSA, developed the 8 dimensions of wellness. And so we're going to watch this, and I want you to think about like all of the opportunities in the supportive housing setting that individuals have to kind of explore these dimensions of wellness, and all the ways in which, if you're ever feeling like stuck in terms of things to work on with individuals, these are areas that you can use this exploration exercise in every single one of these areas, or specifically in areas where people feel they may have deficits in. All right. And my little clicky thing. Oh, wait a minute. Oh, I'm sorry. Let me go back to that. So I embedded it and it's now not playing. So luckily, let me just stop share, because I wondered if that would happen, because I've been having issues with.
Because you're well versed in this, Dawn, and you're
because
an
I
expert
know
trainer.
that Zoom will mess up as soon as I need it to work correctly. I'm sure it's something that I did, but I will blame it on Zoom right now. Yeah, let me just share the screen. Emily, if you can just let me know if you hear it.
The Substance Abuse and Mental Health Services Administration, or SAMHSA, created the Wellness Initiative to help people with mental and/or substance use disorders and all people live longer, healthier lives by focusing on the 8 dimensions of wellness that connect all aspects of behavioral health. Improving wellness by taking action on each of these dimensions addresses early mortality from treatable and preventable conditions. Embracing wellness is about life and living and becoming the healthiest you possible. Listen to your feelings, express them to people you trust, and maintain a positive outlook. Make it a point to understand your finances, establish good financial habits, and plan for the future. A sense of belonging and a reliable support system help during difficult times. Make at least one social connection daily. Seek advice from peers or support groups. And create healthy friendships. Enhancing your connection to self, nature, and others brings balance and peace to your life. Take time to discover what values and beliefs are most important to you. Look for satisfaction from things you're passionate about, whether it is through work, school, or volunteering. Reduce your risk of many illnesses by increasing activity levels according to your abilities, getting restful sleep at night, choosing healthy foods, and exploring outdoors to reduce stress and increase energy levels. Be a lifelong learner by expanding your knowledge and finding creative outlets that stimulate your mind and sense of curiosity. Be open to new ideas, insights, and wisdom. A positive environment has a calming effect. Find surroundings that encourage good physical and mental health, and where you also feel safe. At SAMHSA, we envision a future in which people with mental and/or substance use disorders, and all people, pursue optimal health, happiness, recovery, and a full and satisfying life in the community. Wellness is an ongoing pursuit and can be challenging at times, but striving to make small daily improvements is the key to success. For more information and resources about wellness, visit www.samhsa.gov/wellness-initiative.
Thank you, SAMHSA. Okay, let me hurry up and pause because otherwise I'll be embarrassed. It will play something next that I don't want to share because I've had that happen before. Let me go back and share that screen. So I just wanted to pause there in terms of the dimensions of wellness. And in watching that very brief clip, that just kind of gives you an overview of what they are, what all of them are, what each one of them kind of contains. Think about work and how many of those dimensions of wellness not only rely on, thinking about work, think about how many of those dimensions of wellness working well and feeling productive at work relies on, right? If you've ever tried to work while having significant relationship problems, while having an ill family member, while maybe, maybe you're having major renovations on your house, maybe you're in between places to live, maybe you're, with the folks and it's not the ideal place for you to be while you're trying to work, right? Maybe finances aren't so great and you're working at a place where they're not financially compensating you enough and you're having to work multiple jobs. And so you're not 100% at any one of those jobs. Working in mental health, I know a lot of us have experienced that. So, think about all of those areas of wellness that are kind of ripe for developing when an individual also says, I might want to work, right? So when we think about offering intentional services to people, and I know that sometimes engagement can be really difficult, and this is something that Emily and I were talking about a couple weeks ago, this idea of engaging with individuals when they say they have no goals, when they can't think of one, when things are kind of stable, right? They've got housing, they're able to kind of they're paying their bills or doing this stuff. and they're having a really hard time, especially if they've kind of come out of crisis and they're feeling safe right now to start stretching again and shooting for these other goals. Also consider how many of these dimensions of wellness that being happy at one's job can also support, right? If you're working in an environment like, let's say, in supportive housing or outpatient mental health or any mental health setting, homeless services, that you're actually helping people and you can see tangible changes. That's one of the things that I loved about working in community health, was I was able to see somebody go from, outreaching them on the street to transitioning into having their own apartment and maybe developing a relationship with a significant other and maybe working and feeling like they're truly integrated into the community. You could see that, you could feel it, and that rejuvenates your soul when it's aligned with your values. So it complements your spiritual dimension of wellness, or fortifies the spiritual dimension of wellness, while also fulfilling that vocational or occupational dimension, right? So when we think about work, and when we think about, there are also other aspects of life. I consider dating and social relationships, like intimate relationships, another one that can touch on so many of these other aspects. And I think it just shows you kind of the intertwined nature of ourselves as whole people. So one of the things that I offered here is just a simple goal exploration exercise. This comes from Therapist Aid, I think it's .com. I love their website because it's free. They have a lot of, and again, it's in the resource section in this PowerPoint. They have a lot of free downloadable worksheets, journals, things like that you can use. A lot of them really don't take a lot of special skill sets. So like you can use them with individuals that you're working with, download them, print them out, maybe send them to them if they're email savvy. But you can work with individuals around various goals. So actually the worksheet that I took this from is a wellness, it's all the dimensions of wellness. It's the 8 dimensions of wellness that were looked at. And the one that I pulled out was career. So as you see here, it asks about a 5-year goal, and you can be the guess on whether you could be a better judge of whether or not you want the person to project out that far. Sometimes individuals with especially anxiety disorders like PTSD may find it difficult to project out that far, because one of the aspects of a anxiety disorder sometimes is this like shortened sense of future. And so like you may not take it out that far. You see here, we start with a 1-month goal, and that might just be like, I'll look at job sites, or I'll do this ONET survey, which we'll get to next, or I'll do this VIA character survey. Maybe you as the practitioner will help them complete that if they're not super computer savvy because they're web-based. But maybe it's doing something like that, like just some exploration about what do they like? What do they value? What are job tasks that they like to do, right? So that might be a 1-month goal, and you may put it out to a 3-month and 6-month, maybe as far as you take it, maybe, right? So knowing that you don't have to use exactly what's on this form, exactly the way it's used, but this just kind of gives you an idea to start like breaking down some of those goals into shorter term objectives that are really going to build upon themselves. It may include some self-care, right? So somebody may want to work, but maybe their sleep pattern, their sleep hygiene is terrible. I experience that sometimes. And so it may give them, well, what are you going to have to do if you need to work, or I'm going to have to get up by a certain time? Okay, how's your sleep? Not so great. So it may prompt you to also go work on some other goals, which are all related to this overall goal of returning to work or exploring a career. And again, like I said, this is not just for career. This can and should be done for all aspects of life. So another tool that is kind of in the arsenal for you to use is this thing called the ONET Online Interest Profiler. So in the reference slide, I gave you the direct link, I believe, to the profiler. When you go to ONET Online, I find that there's way too much information on the landing page. And so that's why I took this picture. You see on the right-hand side, there's a little purple box that says, I want to be a. If you click on the ONET interest profiler, it will take you to an area where you enter some information. I believe you may need to enter an email address. So again, these activities, while they are helpful, fairly easy to use and navigate, an individual is going to have to be able to access them. And so that might set up another goal, right? To create an email address. And so once an individual kind of taps into this, it will take them through, let's see if I gave you examples. Yeah. So it will take them through things that individuals do in work. And it's going to give you a lot of job tasks like scheduling appointments or working with the public or caring for animals or, delivering services to people with illnesses in a hospital setting, right? So it'll just give you a lot of job tasks that people may perform in different lines of work. And then what it does is it kind of aggregates that and looks at all that and offers you at the end things that are career fields that encompass a lot of those job tasks. And so it'll tell you the ones that have the most job tasks that match what your preferences are. And every time I do it, it tells me I want to be a travel agent. And guess what? I wanted to be a travel agent when I was 12 years old. So I think my retirement plan is, but the internet kind of stole that dream from me because I've not used a travel agent since probably 1998. So, but it will kind of tell you what those careers are and other careers that are similar to them or other kind of job titles that do a lot of those things. And so you may never think that you want to be a travel agent, right? But for me, because it came up with, I love to travel, I like to help people, it kind of blended the mental health and the travel exploration part of my life together. So that is something that's really interesting. Like I said, it's very helpful for us personally, maybe helpful to do a couple times over your career to kind of see where you are and how your interests change. And obviously beneficial for the individuals you work with. Okay, so some of the notes for using the ONET interest profile is, again, you don't want individuals, please, tell people like, don't think about whether or not you have the education or training to do that job. If it asks you, would you like administering medication to dogs, right? Like, don't think like, oh, I'm not trained as a veterinary assistant. I don't know, but I don't know, maybe, or maybe I don't want to risk getting bit, or I don't like dogs at all, right? I love dogs, but I'm just saying, they don't need to think about whether they have the training or experience to do it, just whether or not they think they'd enjoy doing that type of work. Not consider how much money they might make doing that job, because again, there are certain job tasks that may seem like one might not make a lot of money doing this, but they may fit into the larger picture of another career path. One of the other ones that it came up for me was accountant. That might be much more profitable than my current career path, but there's no way. I'm always late on my own taxes. So that's, I don't want to, go to jail for anybody else other than myself. And only consider, again, whether they think they would like or dislike that type of work. That's all we're looking for is interest. And the third and final tool that I want to introduce is this thing called the VIA, I call it VIA, Character Strength Survey. This is really interesting. This is a survey that I recommend to everybody in addition to ONET and something that's unrelated, but the implicit, I think it's Yale implicit bias, might be Yale or Harvard, implicit bias survey, which is fascinating. These are 3 surveys I really encourage people to do because they tell you an awful lot about yourself and things that you don't even recognize at times. So the VIA Character Strength Survey really does help you get to know what are your character strengths, what are the strengths that you hold, that you possess that make you who you are, and kind of develop that vision and mission for what you want to do in life, right? When you folks like talked about finally working in a career path where you felt like, oh, this is it, this is what I'm supposed to be doing, this is why, the mission of your role is matching your values. When there's that disconnect, that's really difficult and just feels wrong and feels like you shouldn't be there, and can create burnout in individuals. So the thing that this survey helps with, and again, it is a scientifically based survey, it takes 10 minutes. It helps you develop your strengths, understanding your character strengths, and being able to start to use them when you show up for work, when you show up in life with other people, and being able to capitalize them does help increase happiness and well-being, does help you find meaning and purpose in life, does help you to boost relationships because you see the roles that you're playing, right? So it may tell you that in this relationship, this is kind of the role that you're playing, and maybe a positive one, right? But it also may show you how people may play off of that and take advantage of that at times. If you kind of like to swoop in and help people all the time and save people, it gives you pause to consider, all these facets of life and how your characters and your character and your values show up in it. Helps you to manage stress and health, again, by capitalizing on those strengths and to accomplish goals. And again, like I see the alignment with vocational services so directly here. Because again, you've heard the old line of do what you like and it will never feel like work. It really is true. And for a very long time, I think some of us probably hit strides in all of our jobs or careers where it feels like that for a while. And then we might hit a rough patch and we have to kind of like retool and change things like how we do things, or maybe some of our tasks. Maybe even it means changing a job or a work team. But when those values align with the values and mission of your organization, it really doesn't feel as difficult to get to work every day. All right, let's see. We have 8 minutes. So I just want to pause here. We're essentially done, but I wanted to open up to discussion if anybody had any questions or suggestions or knows about more local Washington resources. And I haven't looked at the chat. So if anybody's already entered some suggestions into the chat, thank you. It's not that I'm ignoring it. I just can't look at both at the same time. What's one step that you're thinking of that maybe you have a person in mind that you've been working with, or maybe you don't know anybody at this point yet who might be thinking about work, but what's one step that you can use to engage your supportive housing tenants in vocational or occupational exploration? And a legitimate answer could be that you're going to take these surveys for yourself and just become familiar with them and see how they help you through that experience. So if anybody has any thoughts. Yes, I'm sorry, Emily, I'm looking at questions that you've already answered. Sorry.
I want to highlight what Shaili just said. So Shaili shared that they're a recovering person coming out of homelessness and a success story. I agree, you absolutely are a success story. I'm not going to reread what you said, but to go through that experience, like you said, in your 40s and then come out of it and be here now. I mean, like, what kind of full circle moment is this for you, right?
Bravo, kudos.
Absolutely, right? You're here in this training, working in supportive housing, talking about how you can support other people in their employment endeavors. That's amazing.
And I think that, what do we call it? Therapeutic use of self. I used to call it oversharing until I figured out what to share and what not to share. But I think that therapeutic use of self that we can use in, behavioral healthcare programs, in community service settings. So many people have so many experiences that a book cannot teach us, right? That an educational program cannot teach us. And the individual that I was thinking of, Shaili, that I had mentioned earlier, had transitioned from, she was actually incarcerated, then homeless, then, and she was in recovery from a substance use disorder. domestic abuse survivor, ended up on SSI, was in our PATH homeless outreach program, transition to supportive housing, went through our peer support program, became a certified peer specialist in New Jersey, started working in our homeless outreach program, then became a peer advocate in our support, or a peer navigator, I forget, in our supportive housing program. And then she was able to remain in her apartment, but not lose it, but give up her subsidy. And because she had earned income now, she had private insurance, she had all this stuff, she was able to buy a car. And you know what she said to me that was so touching? It wasn't that she accomplished all these things that made her feel great. She said, now I can give that subsidy to somebody else who was in my position. And not only can they use that, but I can also use my experience to help them recover as well in those other ways, right? And so knowing that worked, and it wasn't just work or supported employment that helped her get to that point. You know, it was a lot of therapy, it was a lot of self-work, and all of that, you know, was amazing to see that, you know, work was such a key part of that. And it's sometimes we don't think of work as that, as powerful as that. So I want to really thank you for sharing, Shiley. That was amazing. Anybody else? Right. So absolutely. Rob says,
Sorry, Heather.
yeah, sorry, Heather. Absolutely. If you have time, and I know you all are extremely busy because again, Emily and I have done this job. Please take the time to work through a couple of these surveys for yourselves. If it's like a rainy Sunday afternoon or something and you want to do it again, they're like 10 minutes. So they're like nothing when it comes to that, but what you get out of them as a product is really helpful. So I want to thank you all. I appreciate your attendance. Kelminda, I appreciate your guidance on terminology, because that is something that I'm continuing to try to be better at. And I love this community because of that, the Washington Learning Community. So with that, we have about 3 minutes left. We're going to go ahead and wrap up, and I want to thank you all and hope you have a wonderful, productive day, and see you all next month.
Take care, everybody.
Bye, all.
Do you want me to stop the recording, Dawn?
You can do it. It's fine. You can just end it.